April 19th, 1987, Middlesex Hospital, London. Princess Diana walked into the AIDS ward wearing a pale blue suit and no gloves. What happened in the next few minutes would change medical history, challenge centuries of stigma, and save countless lives. But what was truly shocking wasn't that Diana touched an AIDS patient. It was that in 1987, even doctors were afraid to do so. To understand the magnitude of Diana's gesture, you need to understand 1987. AIDS was a death sentence. The diagnosis meant you had maybe 2 years to live, maybe less. There was no treatment, no hope, no cure. But worse than the disease itself was the stigma. AIDS patients were treated like modern-day lepers, isolated, abandoned, feared. Even their families wouldn't touch them. Even healthcare workers wore full protective gear, gloves, masks, gowns, treating AIDS patients like they were radioactive. The public believed AIDS could be transmitted through casual contact, a handshake, sharing a cup, breathing the same air. These weren't fringe beliefs. These were mainstream fears promoted by ignorance and amplified by panic. Politicians called AIDS a plague. Religious leaders called it divine punishment. The media called AIDS patients victims of their own lifestyle choices, and AIDS patients themselves became society's untouchables. In 1987, if you had AIDS in Britain, you were likely to die alone. Your friends would stop visiting. Your family might disown you. Your employer would fire you. Your landlord would evict you. You became invisible, less than human. A disease first, a person second. The loneliness of AIDS patients wasn't just emotional, it was physical. People literally would not touch them, wouldn't hold their hands, wouldn't hug them, wouldn't offer the basic human comfort of physical contact in their final days. The medical establishment, which should have known better, perpetuated these fears. Hospitals created separate AIDS wards, quarantine zones. Patients were isolated not just from the public, but from other patients. Nurses and doctors wore excessive protective equipment, even for basic interactions. The message was clear. These people are dangerous. Stay away. Some hospitals even refused to admit AIDS patients at all. Let them die somewhere else, anywhere else, just not here. Into this atmosphere of fear and ignorance walked Princess Diana. She had been briefed about the new AIDS ward at Middlesex Hospital. She was there to officially open it, to bring publicity to the issue, to show royal support for AIDS research and patient care. But briefings and photo opportunities were one thing. What Diana did was something else entirely. Diana had done her homework. She had met with doctors, read medical journals, talked to researchers. She knew the facts. AIDS could not be transmitted through casual contact. You couldn't catch it from a handshake. You couldn't catch it from touching someone's hand. The science was clear, but science and public perception were two very different things. Diana knew that opening this ward, visiting these patients, it wasn't enough. She needed to do something more, something that would force the world to pay attention. The hospital staff had prepared for Diana's visit carefully. The patients who would meet her had been selected. The photos would be controlled. Everything would be dignified, appropriate, safe. When Diana arrived, the hospital director gave her a tour, showed her the facilities, explained the protocols. And then came the moment. Diana was introduced to a patient. His name has never been publicly revealed, but we know he was in his 30s, thin, weak, dying. The photographers were ready. This was the shot. The princess with the AIDS patient. Historic, important. but they expected the usual royal protocol. Diana would stand at a respectful distance. She would smile kindly. She would say some comforting words. She would be compassionate but careful. That's what princesses did. That's what everyone did. No one touched AIDS patients. Not without gloves, not without protection, not if they had a choice. Diana walked to the patient's bedside. She smiled at him. Not her public smile, her real smile. Warm, genuine, human. And then she did something no one expected. She reached out her hand. Her bare hand. No gloves. Nothing between her skin and his. She took the patient's hand in hers. And she held it. Not briefly. Not for the cameras. She held it like she would hold the hand of anyone who was suffering. With compassion. With humanity. With no fear at all. The cameras captured the moment. Click, click, click. Diana, Princess of Wales, holding the hand of an AIDS patient, skin to skin. The photos would appear on front pages around the world. But in that moment, in that hospital room, it wasn't about the photos. It was about the man whose hand she was holding. A man who probably hadn't been touched with kindness in months, maybe years. A man who had been told by society that he was untouchable, unclean, dangerous. Diana sat on the edge of his bed. She talked to him, not about AIDS, not about his illness. She asked him about himself, his life, his family. She treated him like a person, not a patient, not a victim, not a cautionary tale, just a person. For those few minutes, he wasn't dying of AIDS. He was having a conversation with the most famous woman in the world, and she was treating him with dignity. When Diana left the hospital, the media coverage was instantaneous. Diana breaks AIDS taboo. Princess touches AIDS patient without gloves. The photos were everywhere. Diana's bare hand in the patient's hand. Some praised her courage. Others questioned her judgment. Was it safe? Was it appropriate? Was it sending the right message? But the medical community knew exactly what message Diana was sending. And it was the right one. Dr. Jonathan Webber, one of Britain's leading AIDS researchers, said later, Diana did more to educate the public about AIDS transmission in 5 minutes than we had managed to do in 5 years. One gesture, one handshake, one moment of human compassion, and suddenly the world was paying attention to the science instead of the fear. If Princess Diana can touch an AIDS patient safely, people thought, then maybe the rest of us can too. But Diana wasn't finished. The Middlesex Hospital visit was just the beginning. She became a champion for AIDS awareness. She visited AIDS wards regularly, not for photo opportunities. She genuinely cared. She would sit with patients for hours, hold their hands, listen to their stories, treat them like human beings when the rest of the world had decided they weren't worth saving. In 1989, Diana opened Britain's first purpose-built HIV/AIDS unit at Middlesex Hospital. She named it the Broderip Ward. But more importantly, she challenged the director on one specific policy. Why are AIDS patients kept in separate rooms? Why are they isolated? The director explained it was for infection control, to protect other patients. Diana shook her head. They're already dying alone. Don't make them spend their final days in solitary confinement too. The policy was changed. AIDS patients were integrated with other patients where medically appropriate. It seems like a small thing, but for patients who had been isolated, stigmatized, and forgotten, it was revolutionary. Diana had used her influence not just for publicity, but for practical change, for making patients' lives better in their final days. Diana's approach to AIDS advocacy was personal. She didn't just appear at galas and fundraisers, though she did those too. She visited hospices. She held babies with HIV. She attended funerals. She stayed in touch with patients she'd met. When they died, and they all died in those days, she grieved. This wasn't royal duty, this was genuine compassion. One story captures Diana's approach perfectly. She was visiting an AIDS hospice in London. A young man, maybe 25 years old, was in the final stages of the disease. He was skeletal, covered in lesions, barely conscious. His family hadn't visited in weeks. He was dying alone. Diana spent an hour with him, holding his hand, talking quietly, reading to him. The hospice staff tried to move her along. "Ma'am, there are other patients." Diana refused. "This man is dying. He deserves company." She stayed until he fell asleep. The young man died 2 days later. Diana sent flowers to his funeral. She sent a personal note to his mother. She did this again and again, for patients she'd met, for families she'd comforted. This wasn't for publicity. Most of these gestures never made the news. Diana did them because she believed every life mattered. Every death deserved to be mourned. Every person deserved dignity. But Diana's advocacy went beyond individual compassion. She challenged government policy. She pushed for more funding for AIDS research. She demanded better treatment for patients. She spoke publicly about the need to end discrimination. In 1991, she gave a speech that shocked many. She said, "HIV does not make people dangerous to know. You can shake their hands and give them a hug. Heaven knows they need it." The backlash was immediate. Conservative critics accused Diana of promoting immoral behavior, of normalizing a disease caused by sin. Religious leaders said she was misguided, that AIDS was God's punishment and compassion was enabling sin. Diana didn't back down. She doubled down. She visited more wards. She held more hands. She appeared in more photos with AIDS patients. Her message was clear. These are people. They deserve love and care. Period. Diana's work had a measurable impact. Studies showed that after her hospital visits and public statements, more people were willing to donate to AIDS charities. More volunteers signed up to work in hospices. More families reconciled with dying relatives. Public opinion shifted. Slowly, gradually, but it shifted. And it started with one handshake in 1987. But here's what made Diana's advocacy so powerful. She admitted she was learning too. She acknowledged her own initial fears. In one interview, she said, "When I first heard I was visiting an AIDS ward, I was nervous. I didn't know what to expect. But then I met the patients. They were scared, lonely. They needed someone to treat them normally. So I did." That honesty, that vulnerability made her message more powerful. She wasn't claiming to be fearless. She was saying she overcame her fear. And so could everyone else. Diana's influence extended internationally. She visited AIDS projects in Brazil, where she was photographed hugging children with HIV. She visited New York and sat with AIDS patients in Harlem. Everywhere she went, the message was the same. Touch, connect, care. Don't be afraid. In countries where AIDS stigma was even worse than in Britain, Diana's visits were revolutionary. If British royalty could embrace AIDS patients, then anyone could. One of Diana's most important contributions was giving AIDS patients visibility. Before Diana, AIDS patients were hidden, kept out of sight. Diana brought them into the light. She showed their faces, told their stories, made them human in the public consciousness. This visibility was crucial for changing attitudes. It's hard to fear someone when you see them as a person with hopes, dreams, and families. In 1997, just months before her death, Diana auctioned 79 of her dresses to raise money for AIDS charities. The auction raised over $3 million. But more than the money, it was symbolic. Diana was literally giving away pieces of her royal image to help AIDS patients. She was saying these lives matter more than designer gowns. These causes matter more than royal glamour. When Diana died in August 1997, the AIDS community mourned deeply. Patients who had met her felt they'd lost a friend. Activists felt they'd lost their most powerful advocate. The International AIDS Conference held a moment of silence. Hospices around the world held memorial services. For millions of people affected by AIDS, Diana's death wasn't just the loss of a princess. It was the loss of someone who had truly cared. But Diana's legacy in AIDS advocacy didn't die with her. The foundation she helped establish continued her work. The attitudes she helped change continued to evolve. The stigma she challenged continued to decrease. By the early 2000s, new medications had turned AIDS from a death sentence into a manageable chronic condition, and public attitudes had shifted dramatically. People with HIV could live openly, work normally, love freely. Not completely without stigma, but incomparably better than in 1987. Medical professionals credit Diana with saving lives, not through research or medicine, but through changing public perception. By encouraging people to get tested, by reducing stigma so people would seek treatment, by promoting compassion so patients wouldn't die alone. Dr. Anthony Fauci, America's leading AIDS researcher, said, "Princess Diana's contribution to AIDS awareness cannot be overstated. She used her celebrity to challenge ignorance at a time when ignorance was literally killing people." In 2017, on the 20th anniversary of Diana's death, Prince Harry continued his mother's work. He got tested for HIV live on television. The test was negative, but that wasn't the point. Harry was showing that getting tested was normal, safe, important. He spoke about his mother's legacy. "My mother knew that if she treated AIDS patients with dignity and respect, others would follow her example. She was right. Millions of people have followed that example." Prince William has also honoured his mother's AIDS work. In 2016, he appeared on the cover of a gay magazine with the headline, "No one should be bullied for their sexuality or any other reason." His mother would have agreed completely. The princes learned from Diana that royal status comes with responsibility. The responsibility to use your platform for good, to challenge injustice, to stand with the marginalised. Today, in 2025, AIDS is still a serious disease, but it's no longer the death sentence it was in 1987. People with HIV can live long, healthy lives. They can have children who are HIV negative. They can work, love, and thrive. The stigma, while not entirely gone, has decreased dramatically. And much of that progress traces back to one moment in 1987, when a princess reached out her hand and refused to be afraid. Here's what makes Diana's handshake so significant. It wasn't just about AIDS. It was about human dignity, about refusing to let fear overcome compassion, about using privilege and platform to challenge injustice. Diana could have stayed safe. She could have worn gloves. She could have kept her distance. No one would have blamed her. But she chose courage over comfort, connection over caution, humanity over protocol. The patient whose hand Diana held in 1987 the one in the famous photograph, died later that year. His name was never publicly revealed because he wanted privacy. But his family later said that meeting Diana was one of the happiest moments of his final months. He felt seen, valued, human. For a brief moment, he wasn't just an AIDS patient. He was someone worthy of a princess's time and attention. That's the real legacy of Diana's handshake. Not just changing policy or shifting public opinion, though she did both. The real legacy is in the individual lives touched. The patients who felt less alone. The families who found courage to reconcile. The healthcare workers who learned to treat patients with dignity. The millions of people who saw those photographs and thought maybe, just maybe, we should stop being afraid and start being human. From a letter Diana wrote to an AIDS activist in 1995. People ask me why I'm so passionate about AIDS work. They wonder if I'm trying to make up for the failures of my marriage or seeking attention. The truth is simpler. I've sat with too many dying people who spent their final days alone. I've held too many hands that no one else would hold. I've looked into too many eyes that reflected nothing but loneliness and fear. I do this work because it's the right thing to do, because everyone deserves compassion, because love is stronger than fear. That's not complicated. That's just human. The final photograph in our story shows Diana at an AIDS hospice in 1996, 1 year before her death. She's sitting on a bed holding the hand of a patient. She's not looking at the camera, she's looking at the patient, listening to them, being present. Her face shows no fear, no disgust, no performative compassion, just genuine care. That image captures everything Diana believed about AIDS advocacy. It's not about grand gestures. It's about being willing to sit with suffering, to offer comfort, to refuse to look away. In 1987, that was revolutionary. Thanks to Diana, it became normal.